Nipah virus infection. So what is Nipah virus? So Nipah virus is infection viral zoonosis caused by Nipah virus, genus Henipavirus, both animals and humans. So this is how Nipah virus. So they will collect from the. It was defined. It was identified fruit bats of which are also natural hosts of the virus. So how the structure of Nipah virus. So it comes from the bats, sick pigs. Out of an estimated 582 human cases, Nipah viruses, 54% were fatal. So how the world will be affected? In that Asian countries are more affected from Nipah viruses. So how to identify? What are the clinical significance, clinical manifestation? What are the signs and symptoms for Nipah virus? Usually symptoms started from the appear within the 3 to 14 days after exposure. Initial symptoms are fever, headache, drowsiness and mental confusion. These are the initial symptoms. So sometimes symptoms progresses like into coma fast as 24 to 48 hours. Encephalitis, dreaded complications, Nipah virus infections. So how the framing of Nipah viruses organostructures. So respiratory illness can also be present during the early parts of the illness. So the fruits of bats of Nipah virus. So Nipah cases, patients who are breathing difficulty are more likely than without respiratory illness to transmit the virus. So how the Nipah virus from the animals and humans they affected through sick pigs and from the bats. The disease suspected in symptomatic individual in the context of an epidemic outbreak. What are the diagnosis tests for using the Nipah virus to estimate the analysis? So laboratory diagnosis Nipah virus infection made using real-time PCR, RT-PCR, throat, the sample taken from the swab, throat swab, cerebral, spinal fluid, urine, blood analysis during acute convulsion stages diseases. So this is the how they are going to collect the sample from throat swab, urine and blood and CSF. So immunohistochemistry on the tissues collected during the autopsy confirmation to the disease. Viral RNA can be isolated from the saliva infected parcels. Immunoglobulin IgG and IgM, the gamma and mu antibody detection can be done from after the recovery of confirmed the Nipah virus infection. So what is the treatment? Ultimately, after the diagnosis will confirm the Nipah virus. What is the treatment for the Nipah viruses? So there is no specific treatment for the Nipah viruses. Primary treatment is intensive support care. Currently, there is no effective treatment for the Nipah virus infection. The treatment is limited from supportive care. It is important to practice stand infection control practice, proper barrier for nursing technique to avoid the transmission of Nipah virus infection person to person. So all suspected cases Nipah virus infection should be isolated given intensive supportive care. So ribavirin has been shown effective in vitro test but has not yet been proved effective in human. So antimalarial drug like chloroquine. Then the human monoclonal antibodies M102.4 in Australia. How to prevent the Nipah virus? The prevention of Nipah virus infection important since there is no effective treatment for the disease. The infection can be prevented by the avoiding the exposures of bats in endemic areas and sick pigs. These are the sick pigs. So how the transmitted in the disease through bats and sick pigs and horses. Drinking of raw palm soap. So this is the how they transmitted. Bats are known drink toddy, that is collected open the containers and occasionally urinate in it which makes it contaminated with the virus. So these are the bats. So how the survival? So Hendra G protein was found to produce the cross-protective antibodies. Henovirus like Nipah virus has been used for the monkey protect against from the Hendra virus, although potential use human has not been studied. So what are the risks of exposure? So fruits of bats are natural reservoirs of Nipah viruses. The risk exposure high hospitals workers like caretakers who are infected with the virus. Recently, Malaysia, Singapore Nipah virus infection occurred. Those with the close contact with the infected with the pigs. In Bangladesh and India, the disease has been linked to consumption of rotted subworms and contact with the bats. This is how Nipah virus to transmit the organogram. So Nipah virus now arising in India. For the first time in India, an outbreak has been reported in India, Kozhikode district of Kerala. So in India, spreading Nipah virus recently, it is day by day. 10 deaths have been recorded, including one healthcare worker. Those who have died mainly from the district of Kozhikode and Malappuram, including 31 years of old nurse who was treating patients infected with the virus. So be careful, Nipah virus is going on, but prevention is there, that intensive care support and all those things. So thank you for doing this, supporting for this. Thank you.